You are taking a live look at our audience inside Millikan Auditorium watching tonight's special on the big screen. We're going to be going to my co-anchor, Kristen Lowe, in just a few minutes to take some of the questions from the audience that is down there. But first, we welcome back Marty Lawley from Priority Health and Jeff Rubelski from Blue Cross Blue Shield of Michigan. Thank you so much for coming in tonight, guys, and giving us both an employee as well as an employer's perspective at the changes. We've got some other questions that have been submitted here. And Marty, this first question is for you. If my employer offers coverage, can I get coverage from the new ACA plan?
So if your employer offers coverage, that means they're probably making a contribution for your coverage. So the employer is paying a portion of the cost. And so if you leave your employer's plan, you forfeit the contribution that the employer is making. That's one key element to remember. The second is, as employees, when we pay for our coverage through our employer, it's pre-tax, right? It's when you look at your payroll stub, you pay it before you pay taxes. And so that benefit would also go away when you go to purchase a product from the exchange or through the individual market. But I think the question primarily is about whether or not you can access those subsidies, so that federal help, that discount where the federal government's going to help pay for a premium. And the answer to that in most cases is no. So if your employer offers you a plan, a great benefit package at your place of work, you most likely will not be able to buy a product and receive federal assistance through the exchanges or the individual market.
And I imagine that both of you have probably spent a fair amount of time in the last year or so looking at all of that and seeing, is that the case? And as a general rule, that holds true.
It holds true. The specifics of that rule are that you cannot, if you pay more than 9.5% of your income or your wages for the single coverage, so for the employee-only coverage at your employer, then it's unaffordable to you, and you can access subsidies. But in most cases, in my experience, employers do not have cost-sharing amounts that high.
All right, Jeff, I have a question here for you. What happens if my employer drops the coverage? And do you think most employers will do that?
Two-part question. If your employer drops coverage, certainly in 2014, regardless of employer size, there is no employer mandate. So if the employer drops coverage, then the individual can go to the exchange in most cases.
Okay.
And depending upon the income, the household income in the family, that individual may be eligible for subsidies. And so if one does not have coverage through an employer, the first place to check is through the exchange, because that is the only place where there are subsidies available. And sometimes people get confused about that, where they say, gee, if I continue buying my insurance on a direct basis,
right,
I can get these subsidies based on my income. The only place for subsidies is through the public exchange.
And that way we can, as Marty was explaining earlier, if we go to the exchanges, we have a better understanding, too, that we're actually comparing apples to apples and oranges to oranges. Like
Absolutely.
That. All right, some viewers have submitted questions. Is there any way for the consumer to evaluate the advantage of subsidies versus penalties? And if you've been on social media in the last couple of days, you've seen people say, I'm just going to pay for the penalty. I'm just going to pay for the penalty. Is there any way to determine that? Which way to go, other than the disadvantage of not having access to health care? I guess is that the answer?
If you look purely at the cost of coverage versus the price of the penalty, you will most often come to the conclusion that paying the penalty has the lower dollar amount. But again, we're talking about paying a penalty and getting nothing in return. If you put a little bit out, that $4 or $8 a day for coverage, you get that peace of mind, you get that preventive care, you get the ticket to the doctor's office. So this can't purely be an assessment of do I pay a penalty and get nothing versus do I pay for coverage. So give it a look. Go out there, pull out your pencil and paper, write out the pros and cons, think about your family situation, and kind of look at it for each individual specifically.
The other thing that the Affordable Care Act does, when you look at the subsidies, is that it really, as Marty said, it provides that peace of mind. And when you look at bankruptcy in our country, a leading cause is through unpaid medical bills.
Yeah.
And so that is one of the key tenets behind the Affordable Care Act is that individuals will not have to essentially mortgage their future if they have an unexpected health care expense. When you look at the average cost of a hospital admission, it can exceed over $10,000. And not too many people have that kind of money laying around.
Well, welcome back to our 7 at 4 News special, Understanding Healthcare Reform. It is time to take your questions. We have a live audience at Millikan Auditorium watching the broadcast tonight. Our Kristen Lowe is there and has our first question for Jeff and Marty. Good evening, Kristen.
Good evening, Mark. I'm here with Diane West. She works for H&R Block. Diane, you've been getting a lot of questions from some of your customers and from the public. What's your question?
That's true. I do. I'm a master tax advisor and enrolled agent with H&R Block, and we take phone calls from the public and from our clientele as well. What I'm wondering is there an easy way for the client, the taxpayer, or the consumer to evaluate the advantage, to either paying the penalty for not having the coverage or to get a tax subsidy or find a way to purchase in that in the exchanges?
All right, thanks so much. There's the question.
There are some nice tools.
Okay.
I think we'll elaborate on that
Sure.
with explaining some of the tools available. So there's a subsidy calculator that's available today. It already has refreshed with information we have on Michigan rates. It's at Kaiser's Family Foundation website, so you can Google Kaiser's subsidy calculator. You can also go to PriorityHealth.com. We have some tools available to help individuals figure out their subsidy levels and their income and what the cost of coverage will be so that you can compare that then to the penalty.
And we have the same at Blue Cross, at bcbsm.com. Health Reform, /Health Reform can provide that same information. But KaiserKFF.org is where individuals would go for that calculator. And when individuals are making that kind of that trade-off decision of should I pay the penalty or should I have the insurance, I think it's very important to understand how expensive it is to get sick. And so individuals will think they're making a rational decision if they're healthy, having the penalty, but it only takes one event for that to be a really bad decision.
You can add up quickly. All right, a question here emailed to the station. If there are two in the household and one is over 65, currently on Medicare plus additional coverage, the other has no insurance, is the household income based on both even though one is over 65 and already covered? Do you understand the question?
I don't know.
Two people living in the house, one is over 65, covered on Medicare. The other has no insurance. So is the household income based on both, even though one is over 65 and already covered? So how do they determine that household income if one is covered and one is not? Tricky question.
The household income would be determined based on both.
Right.
Yep. So it all depends on how you file your taxes. So it's the modified adjusted gross income. So let me take it a step further. If you have a dependent living with you and you claim them as a dependent, you ought also to include their income as your household income when you're doing this analysis around subsidy eligibility.
Okay, here's a question. We have talked about penalties that individuals will pay. It's a great question. If you do nothing, how do they penalize you? Who's policing this?
Well, that's a good question, and it's the IRS that will police it. And there is some question as to how it will be done, but certainly it will be done via the tax return, and that is how the IRS will assess the penalty based on an individual's tax filing.
Okay, very good. Will hospitals still participate in networks under the ACA?
Absolutely.
Okay.
Hospitals will. It's very important for hospitals to continue their partnership with the various networks.
All right, very good. Let's go back down to Kristen, who joins us now at Millikan Auditorium with a question from our live audience that's assembled there. Kristen, what can you tell us?
Thanks a lot, Mark. I'm here with Betsy Williams. She's from Traverse City. Betsy, what's your question?
Yes, we'd like to know if you have a 26-year-old that is currently your dependent under your plan, what kind of options as your dependent will they have?
I could not hear the question.
Okay, I believe the question was, what happens to my 26-year-old that is still on my family plan? What options will be available to them?
So at age 26, they have to leave the family plan, so to speak, and go get their own policy. And the key there is to understand whether or not they file taxes on their own and can claim their own independent household income, which I would suggest that they do, so that they have a higher level of subsidy that's available to them. So just make sure as you're planning ahead that your dependents file separately so that they will have access to a larger portion of subsidies versus having to consider mom and dad's income or be part of mom and dad's income when calculating what they're eligible for.
Okay, here's the question. Is dental or vision plan part of the Affordable Health Care Act? There's some kind of fundamental things like this that we haven't touched on.
It depends on the size of the group from a group perspective.
Okay.
And from an individual policy perspective, for an individual that buys coverage through the exchange, the answer is yes for pediatric. So pediatric up to the age of 19, I believe, Marty, 19, it is embedded in the coverage. So it is a requirement that the insurance policy purchase has both vision and dental for children up to the age of 19.
All right. I have a pre-existing condition and purchased my insurance through the Chamber of Commerce plan. How will this plan affect me and others like me? I assume referring to this pre-existing condition. If they go out onto the exchanges, how does that impact what's available to them on the exchanges?
Pre-existing condition exclusions or limitations go away under the Affordable Care Act. That's one of the major tenets. And so there'll be no restrictions based on health status or any other restrictions except for age, where you live, and whether or not you're a tobacco user. That's it. So you'll be able to have access to a lot more options in 2014. So your plan that you're on today, upon renewal, will have to become compliant with the new rules under the Affordable Care Act. And so there'll be opportunities now, either in January to go start shopping, tomorrow and look for what's available in January, or when your plan renews to purchase a different plan.
Okay.
The other advantage is what we call portability, because when you look at how insurance is provided today by a number of employers, sometimes people get locked into their coverage. And what the Affordable Care Act will do is if a person changes jobs, changes location, that policy will actually go with the individual. So portability is another advantage.
It certainly is. All right, here's some numbers for you. My employer covers me under their insurance plan. I pay $175 per month. My spouse is self-employed. It would cost $1,500 per month to add him to my insurance. Would it be better for us to get insurance as a family of two through the new health care exchange? I know there's a lot of moving numbers there and everything, but what about a situation like that?
Well, I'll take the first shot at
Sure.
it because there are a number
of
situations. The first question is the individual is offered coverage and pays $175. So the first question is affordability. Is that coverage affordable for that individual? So that's that 9.5% of income test. The second question is coverage available under that individual's plan for the spouse? Most group policies do cover the spouse. And so if the coverage is affordable, then there are no subsidies that would be available through the exchange. So what happens is it locks that employee in plus the spouse to the group coverage. So there's really no financial advantage for going on to the exchange because there are no subsidies available.
All right, very good. All right, let's head back down to Millikan Auditorium. Kristen, another question from our live audience.
Thanks a lot, Mark. I'm here with Tina Poindexter. She's from Traverse City. Tina, what's your question?
My question is, if a family has no insurance coverage currently, will my child still be an option for their kids?
Okay. Did you hear the question?
Yes.
Is that the answer?
My child will be available for the children. Absolutely.
If the family has no insurance.
And what's interesting, what we're expecting with reform is you could have a family with many separate policies. I think we'll see more and more of that. So back to our earlier example, an employee could have employer-sponsored coverage. the child could have my child. Some of the husband could have Medicaid. The other children could have individual policies or Medicaid policies. So we're going to see a lot of variation within a family unit in terms of the types of policies that family is enrolled in.
I imagine that would be the case. All right, here's an interesting one. I have two jobs. One offers insurance, the other does not. So what are the options available for this employer or employee?
Well, again, it goes kind of back to that checklist.
Right.
It is the employer that offers coverage, so we go right down the line in terms of, is the coverage affordable? That's always the first question, and it's at 9.5% of income. So if the individual is not paying more than 9.5% of his or her income towards the premium, then that coverage is deemed affordable. And assuming that that policy is at least the bronze level, which is a 60% value, and most plans are, then that individual is generally best served staying with that employer's policy.
All right. And again, it's the combined income. If this person is working two jobs, it's 9.5% of everything that they bring in, not just from that employer.
It's their wages.
Okay.
So the affordability to determine whether or not the employer's plan is affordable would be based on the wages for that job.
For that job. All right, very good. All right, let's head back down to Milliken. Another question from our live audience.
Thanks a lot, Mark. I'm here with Dave Andrews, also from Traverse City. Dave, what's your question?
I was wondering how healthcare reform is going to impact military personnel or their dependents who may have TRICARE coverage.
Good question.
All right, so the impact that healthcare reform will have on military members, especially if they have their through TRICARE.
No impact.
No impact.
Right.
No impact. So those products will stay intact. Those programs will stay intact. You'll still have that great coverage. You don't need to worry about losing it. You probably won't want to go to the exchange. In fact, subsidies are not available if you have access through TRICARE.
Through TRICARE. Okay, so that's good to know. All right, another one. I'm a retiree, and my company is significantly raising their med plan premiums because their plan is considered a Cadillac plan. What does that mean?
Well, I can tell you this. The Cadillac plan, actually the official Cadillac designation starts in 2018.
Okay.
So I would need a little more information on that. But that's actually when we've heard a little bit about the Cadillac tax.
Okay.
And that tax goes into effect in the year 2018.
All right, very good. Well, we're going to take more of your questions after the break. Again, you can email us, send us a tweet, or call us with a question. You're watching a special report right here on 7 and 4 News. Well, thank you so much for joining us tonight. A lot of people are emailing, calling, tweeting their questions for our experts. So let's get back to the questions. We go back live to Northwestern Michigan College in Milliken Auditorium. 7 and 4's Kristen Lowe is there and has our next question for our experts here in our studios. Kristen, what do you got for us?
Thanks a lot, Mark. I'm here with Jeff Walker. Jeff, what's your question?
I pay for my own health insurance, and I was wondering if it would be wise for me to drop my health insurance and join an exchange.
I think that's a question that a lot of people will have.
And the answer is, it depends.
It depends.
It depends on the income level, the number of dependents. So I think it certainly makes sense to take a look. And I think many folks will have to kind of look at what they're doing right now, especially if they're purchasing coverage on their own. But they need to take a look at what those options will be and if there are any subsidies available through the exchange. And then it becomes really a mathematical decision.
Yeah, I imagine. All right, I'm currently on COBRA, not working, and under treatment. Would I have any advantage to look at the exchange?
Yeah, most likely you would. So COBRA premiums tend to be pretty high.
Right.
Employer-sponsored plans are very robust, and that's why. Now, you want to keep your COBRA coverage until the first of the year, right, because that's when coverage is effective under reform. But you'll definitely want to shop. You'll have a lot more options there, and you can pick the plan that's best for you versus under COBRA, you're kind of stuck with whatever your employer plan is that he or she offers today.
And I imagine, and I'm filling in the blanks off of a one-sentence question here. If they're not working, they're going to meet the income requirements, and under treatment, if there's a pre-existing condition, isn't going to have an impact on the exchanges. Right?
You know, the income requirements are interesting because you have to forecast what you think your income is going to be in 2014. Okay. And if you have an expected change in your income, you really need to go and report that to the federal government because remember, it'll change the discount that they give you to your premium because it's all based on that income, which can fluctuate during the course of the year.
Well, and that's a question that we have here from Andrea. How do you calculate the subsidy if your income varies from year to year?
That's the real question,
okay.
And that's where there will be that reconciliation process, if you will, through IRS, through your income tax returns. Mm-hmm. So it's very important to try to be as accurate as possible. But again, that final check on it is your tax return the following year. And so IRS will kind of take a look and say, here's what you estimated, here's what you actually earned.
All right, very good. All right, let's head back down to Milliken Auditorium. Kristen, what do you got for us?
Here's what you actually earned.
All right, very good. All right, let's head back down to Milliken Auditorium.
Thanks a lot, Mark. I'm here with Sherry Hintz. Sherry, what's your question?
Well, for an individual who's offered only individual coverage from their employer but needs insurance coverage for their family, will the marketplace be an option for their children and or their spouse?
Thank you so much. We talked about this, about how oftentimes an employee and their spouse are covered or their family, but there are situations where that's not the case. So what's the approach?
The spouse and the dependents, if not offered coverage through that employer plan, most likely will have availability to access those subsidies on the exchanges. This is one of those funny questions that isn't crystal clear, and we're excited for tomorrow when the exchanges open up to go and see how it's going to work. If the employer plan is indeed offered to the spouse and the dependents, then they most likely won't be able to get subsidies on the exchange. And so that question of whether it's offered to those additional individuals in the family is a big one.
And how about this one? Are there group plans available to small employers on the exchanges?
Yes. In fact, the public exchange is divided into two areas. The first is for individuals. That's where we spent most of our time tonight. The second part is what is called the SHOP exchange, and that acronym stands for Small Business Health Options Program, and that is for small businesses that employ fewer than 50 full-time equivalent employees. And so there is coverage available. However, because there have been some technical issues, some of the choices that individuals have on the exchange won't be as readily available for small businesses. So the other thing small businesses need to think about is the number of employees that they have and the income level, because there are tax credits and subsidies available to small businesses through the exchange if they purchase through the shop.
Right. One interesting thing, and could be causing a lot of confusion though, is the shop implementation has been delayed. So we won't actually see that exchange operational. So again, the exchange for small employers until November 1st.
All right, very good. Jay writes, are retiree plans subject to the same taxes and fees?
Retiree plans, it really depends as we look at early retirees, which is pre-65 and post-65.
Right. Okay.
But many plans will be subject to taxes and fees, yes. You know, it's interesting. When we look at the Affordable Care Act, virtually everyone, as I said earlier, will pay more to help us to afford coverage for more people.
Yeah. What happens if you have health insurance through work and you lose your job, say in March of 2014, after the enrollment period ends? So what happens then?
There will be some special enrollment,
okay.
Qualifying events. So you have a child, you adopt, you get divorced, you get married, you lose your job. Those are all opportunities for individuals to enroll in a plan through the exchange or in the individual market, or to change their plan. So there really are some designated, very unique situations that allow you that kind of one-off opportunity.
The unforeseeable. All right, let's head back down to Milliken, get the latest from one of our live audience members down there.
Thanks a lot, Mark. I'm here with Tony Stanfeld. Tony is a therapist in Traverse City, and she has a question about part-time employees. What's your question?
My question is that some employers have avoided to paying for benefits by hiring part-time employees, and thus changing the FTE ratio. So what is the responsibility of employers to part-time employees?
Responsibility of employers to part-time employees.
Well, a lot of it really depends on what I call a competitive factor, because employers are going to be making different decisions. But when I talk to employers, a lot of them look at part-time employees from a competitive perspective. Mm-hmm. And so if you have an employer that's in a competitive market for talent and they're not providing benefits for their employees, they could lose those good employees to other employers. So it really depends on each employer.
All right. I would like to know, if I'm a smoker now and I quit, will I still pay up to 50% more for coverage?
No, great question. And you have to be without smoking for about 6 months. So the question's going to ask, do you smoke an average of 4 times a week within the last 6 months, or use tobacco? And if you can answer no to that, you will not get the tobacco rate. So stop smoking right away, and then you can get that preferred smoking rate.
All right, very good. All right, let's head back down to Milliken. Kristen, another question from our live audience assembled there.
Thanks a lot, Mark. I'm here with Tim Town. Tim, what's your question?
My question is, how does the Affordable Care Act affect COBRA coverage? Is there any effect on COBRA at all?
Okay. Is there any effect of the Affordable Care Act on COBRA? We spoke a little bit about the impact that it might have on somebody that is currently paying for COBRA, but does it affect COBRA plans at all?
Well, COBRA is still a law, and employers need to follow COBRA. But the practical matter is that when you look at people who take COBRA, generally it's because they've lost their job, they've lost coverage. And as Marty said earlier, COBRA coverage tends to be very expensive. And so the practical matter is that most people or many people are going to find better coverage, more affordable coverage through the exchange.
Okay. This is a complex question, I think. I own a small business with fewer than 50 employees. What incentive is there in the Affordable Health Care Act to provide health care coverage for myself and my 2 to 3 employees? Will it be more affordable for me to provide that coverage than, say, if I had 50 or more employees?
So really the answer to this question is there aren't any penalties, there aren't any mandates for that small employer to offer coverage. To Jeff's point earlier, you may need to offer coverage to attract and retain the talented employees. From an incentive perspective, that small employer may be able to take advantage of the small business tax credit. Okay. But that really depends on your average salary for your population of your employees. But that tax credit can pay as much as 50%, provide 50% of a tax credit back to the employer for the cost of the coverage that he's providing to those employees. So you really need to check it out. We have a nice calculator online, understandinghealthreform.com, that will help an employer understand if they qualify for that tax credit.
If a person already has Medicaid, do they have to reapply?
No, they do not have to reapply. So the new expanded program is a new program, and new applicants will be able to go into that program, but the current program will stay intact. There is no need to reapply in 2014 for the existing program.
If I have a one-person group policy, does anything change for me? If so, what are my options?
So an individual has a one-person group
policy.
One of the options for a person who just has sole coverage, a sole proprietor, for example, is that person could go onto the exchange and buy coverage as an individual.
All right, they'll be able to do that. All right, excellent. I assume if I lose my job after this year's deadline, the open enrollment issue we spoke, that's one of those criteria.
Special enrollment
criteria that does that. All right, very good. Well, thanks to everyone who submitted a question tonight. We'll be back in just a few moments. We would like to thank all of you for tuning in tonight. You have spent much of the last year traveling all over the state, facing questions just like that.
Yeah.
A lot of people are still very confused about this. A lot of people have a lot of very basic questions. Where can they turn to get better informed so that they can make the best decision for themselves?
There are a number of places where an individual can go. The first is healthcare.gov. Healthcare.gov is really the gateway for the exchanges. There are navigators. Michigan has 4 official navigators appointed, and those navigators can be supplied by the folks at healthcare.gov. There are agents and brokers that are certified. There are community resources. There are a lot of resources to help people make really good decisions.